The study from Yale was that 68,000 people a year die. If you got the money, you got the best healthcare system in the world. We can blame whoever you want, but this is where we're
here. Yeah.
Right. They don't acknowledge it.
What happens when a US senator and a stand-up comedian sit down to talk about healthcare, education, and the future of America? Surprisingly, a lot of truth.
If I asked you, how are we doing as a nation?
I would say we're struggling financially.
Good. That's right.
I think, yeah.
Quality of life.
I think quality of life
That's exactly right.
And I think that we are disillusioned with the institutions that should be supporting and protecting us.
Excellent. All right. So that's right. All that's right. So let's start off with, in one sense, we are the richest country in the history of the world, right? We have enormous wealth.
Yep.
Does that wealth apply to the vast majority of the people?
Absolutely not.
No. So unbelievably, and nobody talks about this. You ask me, we start off on the Democratic Party. The first thing you got to do is be honest with people and say, look, this is where we are at. We can blame whoever you want, but this is where we're
here. Yeah.
Right? They don't acknowledge it.
Bernie Sanders recently sat down with comedian Andrew Schultz to discuss some of the big issues facing the United States: healthcare, education, and why real change seems so hard to achieve. The conversation is honest and grounded, and offers a refreshing look at two very different people finding common ground. Andrew Schultz begins the segment by telling a story about trying to get his daughter into a good prep school, something he admits is a privileged problem. He's not bragging, just being real about the system he's navigating. But the conversation quickly shifts to something much deeper.
So you're living in a country where 60%, let me underline that, 60% of people live paycheck to paycheck.
Yep.
Got it? I grew up in a family that lived paycheck to paycheck. All right? Where paycheck to paycheck is living under enormous stress. How am I going to pay the rent? What happens if my landlord raises my rent? What happens if my kid gets sick and I can't afford to take him to the doctor? You know, what happens if my car breaks down? You know that significant numbers of people in this country, you have money, you don't think about it. But if you don't have any money and your car breaks down,
it's over.
And it's $1,000 bill to get it fixed, and you can't afford it, you tell me what happens. All right. Bottom line is, you got millions of people, working class people, lower income people, struggling to put food on the table. Okay, that is the first profound reality. And the question we've got to ask is, why is that in the richest country on earth? All right, that's number one.
Healthcare in America. Sanders brings up a point that's been central to his platform for years. People in the US are often too afraid to go to the doctor because of the cost. Schultz responds by noting that yes, you can go to the emergency room, but that's not where someone should be finding out they have cancer. By the time someone ends up there, it's often too late. What we're missing is preventative care, routine checkups that could catch things early. Schultz shares his own experience. He once had a tick embedded in his knee after a hike.
Number two, you have a healthcare system. How's the healthcare? You tell me. Got a great healthcare system in America? Well, what do you think?
I mean, if you can afford it, it's pretty good.
That's right.
Yeah, I think that's a better way to look at it.
That's exactly right.
Yeah.
All right. If you got the money, you got the best healthcare system in the world.
Yeah.
But most people don't. How many nations do not guarantee healthcare to all people as a human right? You guys know?
How many?
One major country. You're living in it. So here's the insanity. We are spending twice as much per person on healthcare as most of the European countries.
Guarantee free healthcare, not to correct you, but we won't refuse care if you need it. Oh, wait, we will.
Well, it's a little bit more subtle than that. Yeah. All right. Let's say you have a $10,000 deductible. Okay. Not unusual.
Yeah.
Okay. You get sick. What do? You don't have any money. You go to the doctor?
I go to the emergency room. I say I'm sick.
Yeah, but you go to the emergency room, but you're not like, it's not an emergency. They'll say, well,
I'm just a little bit sick. I just avoid it. That starts to fester. It gets worse.
You got it.
And that actually probably causes more strain.
It does. And you know what else it results in? The study from Yale was that 68,000 people a year die precisely. You go talk to the doctor. Next time you go to a doctor, say, are people coming into your office much sicker than they should be?
Yep.
And the answer is yes, they are.
And that's just avoiding copays.
Exactly.
Yeah.
Exactly.
Okay, fair enough.
So people do die by the large numbers. What about our educational system? Psychologists tell us that 0 through 4, most important years of emotional and intellectual development. Makes sense, right?
Yeah.
Okay. So we must have a great childcare system, right? Because we love our kids, we nurture our kids, we pay childcare professionals. Really, we appreciate them and respect them. We pay childcare workers McDonald's wages.
Yeah. It's shocking. It's also shocking how much competition there is to get your kid into like a favorable preschool.
Right.
Like, you have to start lobbying these preschools at 1 year. My daughter is 15 months, and already now you're like,
He's like a pharma company to get his kid into.
exactly. Like, you're kind of walking in, you're meeting people, they're exchanging pleasantries, and it's all under this guise of, I hope they accept my kid.
Right. Because you have a massive shortage.
Yeah.
And if people don't have any money, it is really difficult.
It was a Sunday night. Clinics were closed, so he went to the emergency room. They removed the tick, gave him antibiotics, and sent him home. The visit lasted maybe 5 minutes, but even with insurance, it cost him $800 out of pocket. He reflects on how backwards that is. The insurance company should have been happy he avoided Lyme disease, which could have cost tens of thousands to treat. But that kind of logic doesn't seem to apply in our system. Sanders agrees and points out that this is why the healthcare system is so broken. We spend more per person on healthcare than any other country, but we don't have better outcomes. He argues it's not a money problem, it's a values problem. The richest country in the world should be able to make sure its people can go to a doctor without going broke.
And so I don't know what it costs here in New York City. You know, in Vermont, it costs $15,000, $20,000. So, if just...
Imagine you have 2 kids, forget it.
That's right, exactly.
Forget it, yeah.
Right, but again, take a deep breath and say, okay, if we as a nation understand that that's the future of America.
Yep.
We want the best. You would say, okay, we're going to have really great teachers for them. We'll treat these teachers with respect, pay them well. They're doing really important work.
Yep.
Taking care of your daughter is important stuff.
Agreed.
Okay? We don't. Public schools, I was talking to a principal in Vermont, in southern Vermont. They're starting teachers off at $32,000 a year. So kids, young people graduate school in debt. We're not getting the best and the brightest people. Do we respect? You tell me, do we respect education in this country? No, we don't really.
What do you mean by respect it? Like,
That we say, man, you're going to be a teacher. That's really
educators. I don't think educators get close to enough
We
respect.
give them a lot
Absolutely.
of platitudes.
Yeah.
Oh,
Yeah,
how
but
noble of you.
say we respect
But
them.
we don't treat them with respect.
We don't feel the same way as if they're like some finance bro or something like that.
Exactly.
Yes, yeah,
All
yeah.
right.
They also talk about how other countries have figured this out. Sanders asks, why aren't we looking at places like Japan, Germany, or the UK, which consistently rank higher in healthcare outcomes? Why not study what they're doing well and bring the best parts of their systems into our own? Schultz agrees and adds that Americans seem oddly resistant to the idea of learning from other countries, even when those countries are getting better results. Education comes up next, and again, Sanders doesn't hold back. He brings up Finland as an example, where becoming a teacher is more difficult. But once someone is a teacher, they're highly respected and left to do their job without being micromanaged. There's no rich schools and poor schools there. Funding is distributed evenly. Sanders argues that in the US, we should be aiming to do the same. Imagine if a wealthy school in Beverly Hills had the exact same budget as a rural school in one of the poorest counties. That would level the playing field. Schultz offers some interesting thoughts on how to encourage more talented people to become teachers.
Yeah.
Just to that point, take a look at it. Harvard College, one of the best colleges in America. Something like 5% of the graduates will go into education, and they're not going into public education.
Of course not, yeah.
50% will go to Wall Street. They'll go to consulting.
You make a great point, though. If college loans are so expensive, they don't even have a choice to go into
Exactly.
education. So is there some sort of system built in where, like, if you choose to go into education, that there's a way that
The loan will be forgiven.
Something like that?
Yeah, there are small programs.
They have something like that. But that's a good
America.
idea. And again, I'm not making this up. I'm sure there was some system like that. But I imagine, like, maybe back in your day, that there was a version where, like, highly educated, not highly educated in terms of a master's program, but like people that went to elite universities, before they went and got their master's or their doctorate, spent some time educating. Was that commonplace?
I'm not sure. I don't recall that. But
like, if there was a way to incentivize that, that might be
right,
good,
of
'cause
course.
you get-
That's right. But what we have to do, I'll give you an example. And what also bothers me is we don't look at what goes on around the rest of the world. You know, we kind of think that we're an island unto ourselves. What we should be doing is what is working around the rest of the world. So you take a country like Finland. To be a teacher is a big deal in Finland. Wow, you're a teacher. It's like being a doctor in this country. You know, people respect them. They're well paid. They have a lot of autonomy, etc. But all that I'm saying here is that if you look at the fundamental institutions in America, healthcare, education, childcare, distribution of wealth in America, we are not doing well. And it's important that we acknowledge that. So, I mean, nobody, you talk about your very kind introductions and, talking about things that others don't talk about. How many people will talk about the reality that Elon Musk himself owns more wealth than the bottom 52% of American households? Is that a moral issue? Are we comfortable with that?
He talks about forgiving student loans for those who go into education, especially in underserved areas. There are some small programs like that already, but they're not nearly widespread enough. Sanders agrees and emphasizes that we need to make teaching an attractive career, not just financially, but in terms of respect and autonomy. This conversation doesn't solve everything, but it starts where real change begins, with truth, empathy, and a willingness to listen. If more Americans had talks like this, maybe the system wouldn't feel so impossible to fix. If you found this conversation eye-opening, like, subscribe, and hit the bell so you don't miss our next deep dive into the issues that matter. Thanks for watching, and we'll see you in the next one.